So other than the obvious of going organic, what are we looking for when it comes to toxins in our food?
Yes. So I think, yeah, as you said, the big one is to go organic, where you will automatically avoid GMO foods because those are not permitted in organic foods. But then, in addition, with autoimmunity, many other additives to food have been found to be important and contribute at least to leaky gut or inflammation or immune dysregulation. This includes additives like emulsifiers, preservatives. A lot of these are the ones that are found in processed foods. And that's the other big category because so much of our society now is processed foods are everywhere. They're a big part of the diet for most people. And often that's where these ingredients and additives that are food toxins can slip through. And then the other thing that it depends on the person, but food sensitivities. So there is with gluten sensitivity, that's on a spectrum. And for certain people, gluten can be toxic. In the literature, that's called non-celiac gluten sensitivity, or NCGS, where a person doesn't have celiac disease, they test negative for the blood work, but they still react to gluten and it as a toxin, and it causes inflammation, it causes fatigue, brain fog, various symptoms that have been reported in the literature. So that's important for some people as well.
All right, so big things I took from that are we're going to remove gluten, processed foods. We're going to stick with organic best we can. While we're on the diet piece, let's talk about if somebody is going to be battling or preventing. So that includes everybody. But let's talk about the diet you're recommending and what that looks like.
Sure. Yeah. So, and I think one other big category I would add is sugar, because that is the other thing that has been shown to worsen autoimmune disease. I'm not talking about sugar in fruits like fructose, because in fruits, it's together with phytochemicals and fiber, so it does not have a negative effect like naturally occurring sugars. But I'm talking about processed sugars, white sugar, high fructose corn syrup. Those have been shown to be inflammatory, and higher levels of intake is associated with more inflammation and more flare-ups in autoimmune disease. So yeah, so that's the other category I wanted to add. And in terms of my overall approach to diet, I break it down into two phases. One is the phase 1 diet, which is more of an elimination diet, where you eliminate gluten, dairy, eggs, soy, most legumes, even nuts and seeds. So it's fairly restrictive, but that's intended to be short term, maybe in the 6 to 8 week range. And then I walk people through an 8-week program for reintroduction, because my phase 2 diet, which is a long-term diet, is really about boosting the diversity of your microbiome and expanding the number of foods that you are including. Because long-term, that is really important to ensure that your microbiome is robust and as diverse as possible, because that's a key factor with longevity and also reduced risk of autoimmune disease and other chronic diseases. So that's my long-term phase 2 diet.
For a lot of people that have found their way to this interview and say they've had an autoimmune condition for a period of time and they've tried to battle it within the natural realm, they're going to have come across the AIP diet. This is the classical, within that natural realm, elimination diet people apply to fighting autoimmune disease. So what I'm curious, how does your phase 1, which is the most limiting, compare to that AIP diet?
Yeah, so I think there's a couple of key differences. So one is that in my phase 1 diet, I do allow gluten-free grains like rice and so for buckwheat. Because what I've seen clinically is that it's pretty rare that people react to these other grains like rice and buckwheat that are gluten-free and generally, very good sources of like phytochemicals, fiber, starch, all the things that we need. So I don't exclude those. And then within the category of legumes, I actually allow mung beans. So mung beans are unique. That's a type of lentil. It's used in Ayurveda as a medicine because mung beans are part of this dish called khichdi, which is made with rice and mung beans and spices, that it's actually very healing for the gut, and it's considered medicinal in Ayurveda, and really never seen sensitivity to mung beans, whereas people are often sensitive to other legumes. And so that also opens up the dietary options. And so, in other ways, I think it is similar to what the AIP diet removes, but I've included a little bit more options. So I think that makes it easier for people to sustain.
One of the things that you mentioned specifically in your diet that you recommend to people is cabbage juice. So this is a unique one. Talk about why that's in the mix.
Yes, so cabbage juice is one of the richest food sources of glutamine, which is an amino acid that in research has been shown to reverse increased intestinal permeability, help with the microbiome. And in my approach is in general, always use food when possible. So if a person is open to it and interested, then juicing cabbage is a very good way to get that glutamine, which is the most important active ingredient. And if a person prefers not to go through the trouble of doing that and would rather take a supplement, that example is okay because glutamine is widely available. It's an amino acid that is sold in supplement form as well. But cabbage juice is one of the best food sources of it.
Another unique piece of the diet that sticks out as I read your book is the broccoli sprouts. And these have gained a lot of momentum in the health world in general. But talk about when it comes to autoimmune disease, why you've included these.
Yes. So broccoli sprouts are the richest food source of sulforaphane, which is a compound that over 2,000 research studies have shown reduces inflammation, supports brain health, it counters oxidative stress, supports the microbiome, supports your neurotransmitters. So many multiple different benefits. And cruciferous vegetables are a reasonably okay source, like broccoli, cauliflower, Brussels sprouts. They do have some sulforaphane. So, but the interesting thing is with broccoli sprouts, they can have up to 100 times the sulforaphane as regular broccoli, for example. So, really, the richest food source of this very powerful antioxidant and anti inflammatory compound. And then I'll just mention one tip for how to boost sulforaphane. So, in your cruciferous vegetables, there was a study that adding a source of this enzyme, myrosinase enzyme, which is found in a brown mustard seed powder. So, in this study, they added a bit of that to cooked broccoli, and the absorption of the sulforaphane was boosted by 400%, by fourfold. So, that's a good way. If you're not able to eat broccoli sprouts, you can have broccoli, but add that mustard seed powder to get a lot more of the sulforaphane absorbed.
I wonder what would happen if you made a sprout salad with broccoli sprouts and put some of that brown mustard seed powder in the mix.
Oh, yeah. Well, the good thing about broccoli sprouts is they are rich in the myrosinase enzyme, so they have it kind of built in. But the other foods that are cruciferous vegetables do not. So that's where you get more of a benefit.
Okay, so we have broccoli sprouts. For somebody that is facing an autoimmune condition right now and they feel overwhelmed, and that sounds like a big thing for them to take on, like the cabbage juice, you mentioned the fact that we can take a supplement for glutamine. Is there a sulforaphane supplement that can take the place of the broccoli sprouts, at least for phases, if people are feeling overwhelmed with everything and say they're all new to this and they just aren't going to do the broccoli sprouts in the beginning?
Yes, absolutely. So sulforaphane supplements are widely available. There's many brands. One that I often recommend to my patients is called Broc Elite, like BROC Elite. I have no commercial affiliation with them, but I just find that to be a good product, standardized to sulforaphane content. So I think a high quality sulforaphane supplement is certainly an option because for whatever reason, many people are not able to incorporate the broccoli sprouts.
We're going to get to gut health as one of the drivers eventually here. But while we're on the food piece, how do you look at fermented foods as a piece of this diet as a whole?
A very big piece. So I think two categories of foods that I strongly emphasize. in both the phase 1 and the phase 2 diet are the fermented foods and prebiotic foods, which we can come back to. Prebiotic foods have fibers that uniquely feed your good bacteria. But with fermented foods, there was a study from Stanford showing that 6 weeks of increasing fermented food consumption in adults reduced 19 different markers of immune system dysregulation and inflammation in the body. Plus, it boosted the diversity of the microbiome, which again is one of those key metrics for longevity. So, pretty remarkable change in just 6 weeks with introduction of fermented foods, and that's why that's a big part of the diet. Even when you're doing the elimination diet, you can have non-dairy fermented foods like your sauerkraut, kimchi, coconut kefir, kombucha, all those things. You don't have to have dairy. And then potentially in the phase 2 diet, you can reintroduce some dairy containing fermented foods. Make sure you tolerate them, of course.
Okay, and when it comes to the fermented foods, before we move into the prebiotic ones, how do we know we're getting enough? Is there a certain amount you recommend per day, per meal? How do people go about navigating that?
So with fermented foods, it does not need to be a high dose. So what I recommend, for example, if a person is willing to have sauerkraut or kimchi, just a tablespoon with your 2 biggest meals of the day is sufficient because it's something that is effective even in low doses. Another example is with kefir. So this is a fermented either dairy or non-dairy beverage, an excellent source of probiotics and good bacteria. But sometimes patients have to start very small. So they might only be able to have like a teaspoon of kefir in the beginning. And then over some months, they might be able to gradually work up to like a full cup. But starting low is often necessary to make sure that people are tolerating them. And then over time, as the gut is shifting, it will be able to handle more and more. But with fermented foods, small quantity, but consistency is the key. Having it like every day or most days of the week, small doses is effective.
And tying back to the cabbage juice, classic sauerkraut is made from cabbage. And when you get to the bottom of the jar, you have that juice there. And obviously that's full of good bacteria. Plus it wouldn't be pure juice, or maybe it would be. I'm trying to think of if there's any water added to making sauerkraut. I think it is actually pure cabbage juice. So I could see how that would be an effective way to get both pieces together.
Yes, absolutely. And with sauerkraut, for my most sensitive patients, I've had them start with just the sauerkraut juice, where they can tolerate maybe a teaspoon of sauerkraut juice and then build up to a couple of tablespoons. And then they can start to tolerate a few strands of sauerkraut and gradually increase that. But sauerkraut juice, very rich in glutamine and beneficial bacteria.
So you talked about the importance of getting these fermented foods in on a regular basis. In your research, what does science show when it comes to repopulating the gut using fermented foods? Is it more so, the way I understand it is that we're constantly adding to the bacteria, but they don't really stick around much. What have you found in that realm?
Yeah, you're exactly right. So, especially with probiotic supplements like capsules of probiotics, they generally don't colonize or establish like a foothold in the microbiome. They, after 2 weeks of stopping taking a probiotic supplement, usually those bacteria are gone from the system. But it doesn't mean that probiotics are ineffective because they're more like immune modulators. They talk to your other bacteria, and then while you're taking them, they can have profound benefits. So when it comes to the food component, it seems like long-term strategy with prebiotic foods is effective at boosting the diversity of the microbiome. The fibers in your diet, especially plant fibers, those are really key drivers of that diversity as well. And fermented foods have been shown to boost the diversity of the microbiome. So I think having a diet with plenty of prebiotic foods, diverse plant fibers, and fermented foods is the best way long-term to boost the microbiome diversity.
You touched on probiotics there in supplement form. For somebody that wants to put that into the mix, Is that a good thing if they're already taking in, a good amount of fermented foods? Do you find that's necessary? And then if so, what type do you recommend? Because there are so many different types on the market now. Ones that need to be kept in the fridge, ones that don't, spore-based, soil-based. There's so many. It's becoming very complex. So how do you feel about probiotics and including them into your diet mix here?
Yeah, I use probiotics a lot. They're a big part of our practice, but I think you really need to work with a practitioner on that because what I have also seen is sometimes patients take certain probiotics on their own and then their symptoms get worse. Their autoimmune disease gets worse. That was not the right fit for their unique situation. So, generally speaking, though, I think that in my book, I mention a few categories of probiotics. So, Lactobacillus rhamnosus GG, which is commonly sold as Culturelle, is the brand, and also present in other brands. That's a species. So, with probiotics, we always want to look at the strain. So, there's the species, and then there's also this individual strain of bacteria. It's very important to take a probiotic that lists this strain because then the company realizes the importance of that. The same species, different strains can have very different properties. So you want to make sure that's on the label. Culturelle or Lactobacillus GG has been researched for more than 100 years. It's been around for a long time, a lot of good data to support the use of it. I think another probiotic that we often use a lot is Saccharomyces boulardii. And the CNCM 745 strain. So with Saccharomyces boulardii, it's a beneficial yeast, and like in our body with good bacteria, we have good yeast as well, and Saccharomyces is one of the key ones. So the good thing about it is then it does not get affected by antibiotics. So just like antibiotics kill bacteria, they do not kill the beneficial yeast. And so Florastore is a common brand, or other products that contain Saccharomyces boulardii. Also, nearly 100 years of research behind that probiotic strain. So those are a couple of good options, but there are many more.
Well, let's move deep into the prebiotic piece. So we're going to get fiber if we're including plants in the diet. It's going to help feed the bacteria in our gut. But when it comes to different types of prebiotic and how much, how often, let's get into the details there.
Yes. So I think, prebiotic foods is a very important topic to discuss. And I like to break it down into the categories of prebiotics, and then we can talk about foods that are examples of each. So in my book, I've given hundreds of examples of these foods because I think the key thing is you don't have to eat all of them. You just have to find some that you like, that you tolerate, that you can have regularly. So the big categories of prebiotics are polyphenols, which are plant flavonoids that feed your good bacteria. And some of those are surprising. So, for example, among nuts and seeds, ground flaxseed is excellent, but chestnuts are the second richest food source of polyphenols, which we often think of as just a holiday food, but very good for the microbiome. When it comes to vegetables, capers and olives are among the highest in polyphenols. So, of course, your leafy green vegetables are great, cruciferous vegetables are great, but that's what I mean in terms of sometimes it's surprising what is highest in the polyphenol content. Other categories of prebiotics are resistant starch. So with that, there's type 1, type 2, and type 3 resistant starch, which we can come back to. There's inulin, which is an excellent prebiotic that is found in many different foods like artichokes, asparagus, onions, and garlic, if you tolerate them. Then there is GOS, galacto-oligosaccharides, which are often found in legumes and beans, which are excellent if you tolerate them. And then there are arabinogalactans, which are in your radish, pear, coconut, other foods like that. So I think at a high level, knowing about these different prebiotics is a good start to then go into the individual foods within each category.
For somebody right now that's feeling overwhelmed hearing about all the different categories, how important is it that we get different foods from each category?
Yes, the thing with prebiotic foods is each of them feeds multiple different species. So I think if you're able to at least include like foods from 2 or 3 prebiotic categories, that should be sufficient. What I tell people is to aim in a week for at least 40 different plant foods, because ultimately that's what drives the diversity, diversity of the diet. So we know with our Paleolithic ancestors, often they would eat 100 different varieties of plant foods in a month. And now the average person, I think, eats less than 10 different varieties in a whole year. So obviously, we can't go back to eating 100 different plant foods, but aiming for 40 in a week. And one tip to achieve that number is that different colored fruit foods count separately. So green apple counts separate from a red apple, separate from a golden delicious apple. Spices are a great way to get those prebiotics. So if you use turmeric, ginger, garlic, cinnamon, and fenugreek in a week, that's 5 plant foods right there. So using tips like that, you can get towards that goal of 40 different plant foods. But it doesn't need to be from every single category. If you at least pick like 2 or 3 categories of prebiotics, that would be adequate.
So it sounds like the easiest way not to get overwhelmed is just aim for that diversity, and you're naturally going to cover foods from different categories.
Exactly.
Let's come back to the resistant starch. When you got to that part, you said there's 3 different types. Let's break those down.
Yeah, so type 1 resistant starch is found in certain grains and legumes, especially whole grains and whole legumes. So oats and oatmeal are a good source. Beans of all types and lentils are great as well. They have that resistant starch in their skin. And other gluten-free grains, sorghum, buckwheat, those are good sources for type 1 resistant starch. Type 2 resistant starch is found in certain foods like green banana, green plantain. There's also potato starch. So these are a little bit harder to find, but if you can usually find plantains in your grocery store, that's an excellent source. If you get bananas when they're a bit more green, then that also contains significant amount of type 2 resistant starch. And the potato starch is type 2, and that's more of a supplement, which you want to work under a practitioner's guidance, but that's another good way to get type 2 resistant starch. And then finally, type 3 resistant starch is retrograde starch, which is formed when certain foods are cooked and then cooled. So with potatoes, like regular white potatoes, that's actually a good source of type 3 resistant starch, like a potato salad, where you would cook it and then freeze or cool it overnight. And then it's pretty heat stable, so it can be heated back to room temperature without damaging the resistant starch. And also you can get the same type 3 resistant starch from white rice or brown rice, cooked and cooled, and with a bit of coconut oil. That is a way to increase the resistant starch content that way.
When you were talking about type 2, you mentioned the fact that you could take a supplement, and that's where I wanted to go next. But you mentioned the fact that if we're going to do that, we want to work with a practitioner. So what you're saying is don't just go to the health food store, grab a prebiotic fiber, and add that to the mix without working with somebody?
Exactly. Yeah. Because, for example, if a person has SIBO or small intestinal bacterial overgrowth, that might be worsened by certain prebiotic fibers. In those cases, you can still use like selective prebiotic fibers, but that's where if you just go to the store and, pick a random one and start with a high dose, there's a high likelihood of like worsening symptoms or causing some type of gut reaction.
When we were talking about food from the toxin perspective, you mentioned GMOs, so obviously we go organic, we're going to avoid those. We're going to avoid pesticides. Have you come across any of the research talking about nutritional profile of food, organic versus conventional?
Yes. In fact, studies show that it's probably true that that organic produce contains slightly higher levels of vitamins and minerals than conventional counterparts, probably because of the farming techniques that are used. The soil is of higher quality. So you're not only getting the lower toxin and pesticide residues, but you are getting more nutrients. And that's very important because globally, soils are very depleted. So that's why the Department of Agriculture has found that an apple today compared to an apple from 100 years ago is much lower in nutrients, and that's true for a lot of different foods. But choosing organic is a way to also maximize the nutrients in those foods.
And while we're in the food category, when it comes to autoimmunity, are there any specific foods that are good for helping fight against that or prevent it? Things that we want to make sure we're including in the diet.
So I think the fermented foods are definitely high on the list because we know from research that they reduce inflammation and also boost the diversity of the microbiome. So that's an essential category. And then prebiotic foods. So just the diversity of those different types of prebiotics, whatever you can tolerate, that will comprise plant food diversity in your diet. So you aim for those 30 to 40 different types of plants in a week. So I think that those strategies long term will be highly successful.
Got it. What I was getting at more was the specific superfoods, like certain things like goji berries or certain foods that are above and beyond that we want to make sure are included in the diet.
Yes, there are a few that I like in that category. One is beet greens, which are the leafy tops of beetroot. They're the richest food source of betaine, which is a compound that helps methylation, a process that occurs like 1 billion times each second throughout your body. And also, they support your glutathione levels. So it's a way to boost your antioxidant and glutathione levels, which are important for your detoxification pathways. We always try to get beets with the greens still attached, and then you can cook them just like you would any leafy green like kale or spinach, and you don't lose any of the benefits. That I consider a true superfood. I think second, I would mention chlorella, which is a type of algae that often is sold in a powder form. I like to add it to my smoothies. Chlorella has some interesting research showing that it may help with excretion of toxins, especially mercury and heavy metals like that. Plus, extremely rich in phytochemicals and beneficial plant compounds. And then the third category of which I'll speak about for superfoods is spices, because I think those are so underutilized and they have multiple benefits for people. Reduce inflammation, they prebiotics, so they boost the microbiome, they help your blood sugar regulation, they're excellent antioxidants, so they counteract the oxidative stress. So I think getting variety of spices, I talk about a bunch of them in both of my books, but I like to really teach people how to use spices. But getting your turmeric, ginger, cinnamon, garlic, those are more well known. And then also if you can incorporate cinnamon, fenugreek, ajwain, black cumin, some of those lesser known spices, you get a lot of bang for your buck with those spices because you're really benefiting multiple pathways and organ systems.
As you talk about beet greens, turmeric, it gets me thinking about oxalates and different plant toxins as a whole. How do you look at those when it comes to autoimmunity? Is this something we need to be wary of and moderating how many we're taking in? Or is that not important when we're going through a protocol like this?
For certain people, it is important, especially if you have a history of kidney stones, which are often oxalate derived. And then in that case, you have to be very careful with not overdoing it in terms of oxalates in the diet. there are other limited population, but some people who do have oxalate sensitivity and get reactions from over consuming oxalates, and that's what you'll figure out when you go through like the phase 1 diet and then reintroductions and see what you tolerate. I know there are some there out there who believe that all oxalate containing foods are toxins for all people, and I just don't really think that's true. In terms of the research, many of these foods are, if you tolerate them and if you don't have a history of kidney stones, are associated with longevity and reduced inflammation and are likely health promoting foods. So for the majority of people, I think they can consume oxalate rich vegetables and foods as part of a balanced diet.
So by the sounds of it, there's different tiers when it comes to elimination diets, when it comes to autoimmunity. Your phase 1 diet, a little bit more intense would be the AIP diet. And while we're talking about plant toxins, it brings up the carnivore diet, the ultimate elimination diet. So there is a lot of talk in the carnivore world about that being helpful when it comes to autoimmunity and using that diet as a treatment. Why not go all the way there, eliminate as much as possible, and then work our way back? How do you feel about that?
Yes, I think for certain people, it can be a game changer. That's what I've seen with some patients that whereas nothing has helped bring down their inflammation or symptoms, going on a carnivore diet really did and was transformative. But then what I've seen is that if they stay on it too long, they start getting negative reactions. And I think the reason for that is that like any elimination diet, the carnivore diet should be more short term. Whether you're doing AIP or the phase 1 diet or carnivore diet, I recommend limiting it to 2 or maximum 3 months, because you're naturally in any elimination diet is very limited. And so you're going to be not feeding as much of the good bacteria. So your microbiome diversity will drop. And in the short term, that's not harmful. But in the long term, if you stick with a very rigid elimination diet, like the carnivore diet, for example, there's a complete absence of all of those prebiotics because they're not found in animal foods. You're not getting any prebiotic foods or fermented foods or plant fibers. And so your microbiome is going to suffer in the long term, which is important for long-term longevity. We have to balance out short-term relief of symptoms, which is important and can be achieved with the carnivore diet. And then after that, you want to have a systematic reintroduction of foods. Try to get the most diversity back in your diet without exacerbating your symptoms, because in the long run, that will support your microbiome better.
So when it comes to these different elimination diets, whether it be your phase 1 diet, AIP diet, carnivore diet, I think it would be helpful for people to understand and get into the details of what introducing foods back in looks like. So can you take us through the details of what that process is?
Oh, for sure. Yeah, I think this is an area where people benefit from a lot of guidance because it's hard to do this on your own. A few concepts that I think are valuable. So one is keeping track with like a food log, food journal. You can use, just in your phone, make notes is very important because over those 6 to 8 weeks of reintroducing, you're going to be reintroducing a lot of foods, and it'll be hard to remember unless you're recording all of these things systematically. Second point is not to introduce multiple new foods at one time. And I recommend no more than 2 new foods per week, because some of these food sensitivity reactions can be delayed by 2 or 3 days. We know based on the antibody that's involved, if it's an IgA or IgG antibody, there might be a delayed food sensitivity reaction. And so that's why if you, for example, on Monday reintroduce almonds, then you don't need to eat that on Tuesday and Wednesday, but you want to monitor for any type of symptoms. So there could be a wide variety of reactions. sometimes GI symptoms, constipation, diarrhea, gas or bloating, or constitutional symptoms, fatigue, malaise, brain fog, joint pains, skin issues. Basically, you want to look for any worsening or any new symptom. And then if you don't have any of those that show up, then you can add that food to the OK list. And then, so Monday you reintroduce almonds, then Thursday you can reintroduce another category. So maybe black beans, for example. So I like to also recommend that people reserve dairy and gluten for the very end, because those are statistically the most likely to be food sensitivities. Gluten, probably the biggest one, which I would suggest to reserve for the end. Dairy, before that. And then in my book, I also talk about the different gradations within dairy, because it's quite different when you go from milk to heavy cream to yogurt to ghee or clarified butter. The levels of casein and lactose vary quite substantially, and that's what leads people to tolerate certain dairy products and not others. So with dairy products, you also want to be pretty granular with how you reintroduce them.
And for somebody that has had an autoimmune condition and they work through your protocol, bring it into remission, how often do you find people in that category can introduce things like dairy and gluten and keep their disease in remission?
Yes, so it depends on the person. With dairy, I've definitely seen more successful reintroductions than with gluten. I think gluten is probably more inflammatory. And with dairy, I often see that it's a subtype. So, for example, a person might be able to tolerate butter, cream, and certain yogurts, but if they're having like milk or ice cream or other dairy, they're getting reactions. So I've seen more success with dairy than with gluten. And I think that, gluten in general is more inflammatory because of how it's been genetically modified and evolved over the past 100 years. There's much more gluten in our modern wheat than wheat that our grandparents might have eaten, 100 years ago. Plus, there's new chromosomes and other results of genetic hybridization that make wheat a bit harder to process. And so for that reason, I think gluten is often inflammatory.
So we went deep into the prebiotic piece, probiotics, and fermented foods in that middle part. Let's move now into the latter part, which is postbiotics. And this gets into how these bacteria, when we give them the right medium, the right foods, and we grow that diversity within our system, how they benefit us.
Yes, absolutely. Yeah. So some of the most important postbiotics, which are metabolites that are produced by your probiotic bacteria, are short chain fatty acids. So these are compounds that are supposed to be made by your good bacteria. They include butyrate, acetate, these type of lactate, these type of organic acids. And they have significant anti-inflammatory effects in the gut. They also help your gut-brain axis. They can even help heal leaky brain. Just like you have leaky gut, if you have an impaired blood-brain barrier, you can have leaky brain. But the short-chain fatty acids, especially butyrate, have been shown to help with healing both of those. With these metabolites like postbiotics, there's two options. You can either take a supplement, which has these short chain fatty acids and other metabolites, but my preference is to really try to get your own bacteria to produce them, which is what they're supposed to do. And, that will have other benefits too, like boosting the diversity of the microbiome, all those butyrate producers. And actually a good metric for short chain fatty acids is stool pH. So this is a test that can be done through any laboratory. It's a pretty old test. But we know from the research that optimal stool pH is acidic, meaning less than 7, around 6.5 or so. And stool pH is mostly driven by short chain fatty acids, these postbiotics. So that's a good metric to track. And often I find that when people are able to boost their, prebiotic foods and their plant food diversity, then their stool pH improves because they're producing a lot more of those postbiotics that are key.
And how quickly could you see that change with the stool pH if somebody started to make some of the changes to help their microbiome?
So there was a study which found that after just 2 weeks of increasing fiber intake, there was a significant drop in stool pH. In that study, participants went from consuming about 17 grams of fiber per day to 34 grams. So they're still not, consuming like 100 grams or 50 grams. It's just getting to that in the 30s, 34 grams. But just in 2 weeks, that was able to bring down the stool pH. So the great thing about the microbiome and the immune system is that it can respond quickly in some cases, and these changes have measurable beneficial effects.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
What we often see in autoimmunity are certain parts of the immune system are hyperactive. Those are the attacking the tissues, producing the autoantibodies, and other parts are actually suppressed, like the part that's supposed to